Imagine holding a sharp piece of obsidian and pressing it against the skull of a living person. You aren't trying to kill them, you're trying to save their life. This sounds like a horror movie, but it was a standard medical procedure for thousands of years. It is called trepanation, and against all odds, it worked. Archaeologists have found over 1,500 skulls from the Neolithic period alone that show clear signs of intentional surgical holes. Some of these skulls date back as far as 10,000 years. That is thousands of years before the invention of the wheel, the written word, or modern anesthesia. You might be asking how anyone could survive this without dying of shock or infection. The answer lies in human biology and, surprisingly, a very sophisticated understanding of anatomy. The human skull is composed of several layers. There is the scalp, the periosteum, and the dense, hard bone of the cranium itself. Beneath that sits a tough, protective membrane called the dura mater. As long as the surgeon avoided puncturing that delicate membrane, the brain remained protected. Neolithic surgeons were not just randomly scratching at bone, they were meticulous. They used tools made of flint, obsidian, or bronze. These materials can be sharpened to a molecular edge, far sharper than even modern steel scalpels. This sharpness was crucial. It minimized trauma to the surrounding tissue and reduced the risk of causing a massive, fatal hemorrhage. But what were they actually trying to fix? Historians used to think this was purely ritualistic. Maybe they were trying to release evil spirits or let demons escape the mind. But when we look at the physical evidence, the story changes. Many of these skulls show signs of blunt force trauma right near the hole. Imagine a warrior in 3000 BC getting hit in the head with a club. The skull fractures. Fragments of bone are pushed inward, pressing directly against the brain. This causes seizures, paralysis, and excruciating pressure. The ancient surgeons saw the problem. They scraped away the bone surrounding the fracture to relieve the pressure and remove the shards. This is essentially the exact same logic used in modern neurosurgery today. We call it a craniotomy. The goal remains identical: decompress the brain. We know these patients survived because of something called bone remodeling. When a person dies instantly during a surgery, the edges of the bone remain sharp and raw. But many of these ancient skulls show smooth, rounded edges around the hole. This only happens if the bone begins to grow back over a period of months or even years. In some cases, archaeologists have found individuals with multiple holes, each showing signs of extensive healing. This means one person went through this procedure 4 or 5 times and kept living. How did they handle the pain? We don't have records, but we have botanical evidence. Ancient cultures across the globe used natural anesthetics. In the Andes, the Inca used coca leaves. In Europe, they likely used alcohol, opium poppies, or cannabis. It wasn't the precise, controlled delivery of modern IV sedatives, but it was enough to keep a patient from moving while the surgeon worked. The success rate is what truly stuns historians. In the mid-1800s, during the American Civil War, surgeons often performed similar cranial surgeries. Their mortality rate was incredibly high, mostly due to infection from unwashed hands and metal tools. Ancient humans had a massive advantage. They didn't have the hospital-borne pathogens of the 19th century. They weren't moving between autopsy tables and surgery wards. They were operating in cleaner, albeit primitive, environments. They also likely understood the benefits of certain antiseptic plants. We have evidence that they used honey, which has natural antibacterial properties, to pack wounds and keep them free from rot. The Inca civilization, in particular, became the masters of this. By the height of their empire, their survival rate for trepanation was estimated to be between 70 and 80%. That is a higher success rate than many surgeons achieved in Europe during the Napoleonic Wars. Think about the sheer nerve required to do this. You are operating on the most complex organ in the universe without an MRI, without an X-ray, and without a blood transfusion. If you cut 1 millimeter too deep, you hit the sagittal sinus, a major vein in the brain. If you cut that, the patient bleeds to death in minutes. The surgeon had to know exactly how thick the bone was. They had to know how to stop the bleeding of the scalp. They had to know the anatomy of the skull like the back of their hand. These were not primitive people. They were medical pioneers operating at the very limit of what the human body can endure. But this raises a haunting question about human progress. We often assume that medicine is a linear path, that we started in the dark and gradually turned on the lights. But these skulls suggest a different story. They suggest that humanity has always been driven by the same desperate desire to fix our broken bodies. We have always been explorers of the interior, even when our only tools were jagged rocks and our only map was the intuition of our ancestors. Perhaps we are not as far removed from these ancient surgeons as we like to think. We have better machines, yes, we have sterile gloves and digital imaging, but the core challenge is the same. We are still trying to protect the fragile spark of consciousness inside a shell of bone. What other secrets are we missing about our ancestors? How much more did they know that we have simply forgotten? As we continue to look back into the history of human survival, we might find that the biggest discovery isn't what we have gained, but what we have managed to hold on to for 10,000 years.